How we talk about the entire respiratory system is we divide it into two major parts, upper and lower. And let's go through the upper tract first. And the reason why it's called upper and lower is because the functioning of what it's doing. Upper is just a traveling or a passageway for the air to get where it needs to, which is eventually the lungs. And then when it gets there, we're exchanging the gases. So upper respiratory, and your nostrils, the real term for them is external nares. Well, if I look on the inside, I'd call that the internal nares. And I'm going to follow through with something that should look familiar because we learned about them when we learned the skull. And those are the conchas, okay, in the skull, in the nasal cavity. So this is the superior, middle, and inferior nasal conchas. And underneath each one of those, there is a slit or a fossa, and those are known as meatus. So this is the superior, inferior, or middle, and inferior nasal meatus. Okay, so now we've already covered 7 things off of our list. So the septum, if I were to look at soft tissue on here, that's the area that we're referring to, the division, okay? But of course we know this is the perpendicular plate of the ethmoid, and this is the vomer down below. Flashbacks to Anatomy 1. All right? Got it? But we call the combination of that, when the tissue and the cartilage is on top of the skull, then we just refer to that as the nasal septum, or that division between the nostrils. So these are the internal nares, but the internal nares are posterior to the conchas and the meatus, right there. So we do have internal nose. So there's the conchas. And we do, I don't really test you on the sinuses again because I'm assuming you know where they are, but because they're in this region, and for you to just get an idea of what it looks like, we have the sinuses again, which I don't believe are on your list, right? Yeah, they're not on your list. Okay, so let's look at these now. So this is the external nares. These are the conchas and the meatus. And the first thing that you see inferior to the last meatus is known as the hard palate. There is no other term for that but hard palate. And when referring to like the nasal and oral cavity, that is the medical term. And then beyond that, and yes, it looks like something that it probably shouldn't. Now you remember. Pharynx. And the pharynx is the entire division of beyond the internal nares. Okay, so what's this here? Hard, not plate, palate, and this would be your soft palate. And then beyond the soft palate, now you're getting into the pharynx. So there are distinct areas of that pharynx that have a specific name. So even though the whole thing is, if we go straight back from the nose to that area, it's called the nasopharynx. If we're going straight back from the mouth, this guy right here is representing the tongue. If we're going back from the oral cavity to that area, we call it the oropharynx. And then below that, we call this the laryngopharynx. Inferior to that, we have the larynx. So just to give you an idea of what this model is, this is the hyoid bone. This is the thyroid cartilage. And inferior to that is the trachea. The trachea is really neat because it is all C-shaped rings, because directly posterior to the trachea we have the esophagus. So it cannot be cartilage rings all the way across, because every time you swallow food, the esophagus will expand and impede upon, like a sturdy structure. So on the posterior side of the trachea, it's really smooth. So this is the posterior. What gland is this? This is the thyroid gland. So on the posterior side, you don't see the cartilage rings. Now in the trachea, the first cartilage ring has a different name, a special name, and it's cricoid cartilage. And I believe I have a slide of it. So this is the epiglottis. It's the flap. So this is the thyroid cartilage, arytenoid cartilage. I don't believe I put corniculate on your list, but they look like horns. And here's the cricoid cartilage I was referring to. It's important to understand the anterior view versus the posterior view. On posterior view of this model, you can see the thyroid gland a little more prominent. And on the anterior view, you can see the thyroid cartilage, taking up a majority of your view. So the first ring is known as the cricoid cartilage. And it just has a special name. Why? Because it's a little bit different shape than the rest of the C-shaped rings going down. So these are the vocal cords, and now I'm taking that same model. So false vocal cords or folds are superior. Your true ones are a little bit medial to those false. And if epiglottis is a flap of cartilage that covers the opening of the trachea or the esophagus, depending on if we're breathing or eating, the term glottis means hole or opening. So this is that glottis representing on the model, because if this is the epiglottis and if this flap closes, what am I closing? The hole. So epiglottis.